When you look at the line of Biosomo, can you go over like what are the key critical kind of top products there? And do you have any kind of notion to expand shortly, or is it right now just on these and focus on this line as it is?
So what we have now is directly, we have like ECGC as a green tea extract. It's very good for cardiological diseases, or I would say for the cardiological health in total. Then we have Boswellia acid. Yeah, so frankincense and curcumin for the anti-inflammatory side of where we are want to have like our impact on. And then we are using alphaliponic acid, as I said to you. Then what we are now trying to build up is a anti-oxygenatic drug like astaxanthin or resveratrol, maybe, for example. Quercetin is a very interesting thing. But this is a development type of question sometimes, because we have to get, first of all, agents, then they have to be in a certain purification, because we cannot use every extract, because then the liposomes are filled up by, I would say, substances we don't like to have in our hiring of bioavailability purpose. Then, this is, I think, what we now developed, and where we are building up a certain amount now is the fat lovely vitamins. And there we also had done with a certain company a patient study where we see like the hiring of uptake directly in real patients, not only on cells. Then vitamin C is a very, I would say, interesting compartment due to acting and interacting with different pathways, like I talked in the beginning of. Maybe the B vitamins. What I'm not very into is like combining all of the substances in one liposomes, because you don't know how much size they fill up in the liposomes. And for curcumin, for example, the phospholipid amount which creates the liposomes and the curcumin amount are calculated. So we know for sure by molecular masses that all the curcumin we put into this agent, after shaking it with a certain amount of water, is really encapsulated. We don't want to have curcumin which is free lying around there, because then again, the toxicity by the liver, sometimes elimination and problems you have, and then you don't have any uptake by the curcumin which is not encapsulated in liposomes. So that's why we are like trying to make substances as pure as they are in a certain way, or only use one substance in a liposomal formulation and not like combine 10 substances in one liposome.
Well, that's the thing about supplementation and formulation. It is an art form. And I think many forget that, and some come into the marketplace and just say, let's grab whatever's trending, throw it in a capsule, get it as cheap as possible, and put a lot of marketing to it. And let's take these, top ones, whatever it is, the flavor of the month, and add it with this and do this. And it doesn't work that way. You can't just do it that way. It has to start with quality, number one. It has to start with some synergy. It's like, I all said, this is like cooking a very good meal. It's not that more ingredients and things go together well. Sometimes it tastes like shit. It's like, totally, you can't just throw everything together because it's cool. Oh, let's do collagen with this Wagyu steak and all this. Like, no, that's not how it works.
What I also see is that many of our agents we are using, when we are using them right and they are available for our body, they are multifunctional. So what we are doing with natural compounds, that's why I like very much natural compounds, even due to the fact that I'm educated, school-wise, very pharmaceutical. Yeah, I like these natural compounds because they are doing many things to help and to do good things in an easy way, not to go very into detail in our body. Like a normal pharmaceutical compound, its purpose is to lower one value. I see on the blood levels, okay, this value I want to lower, I give this compound. Then the other value goes higher, then I give this compound. And they have no purpose besides lowering a certain value. A curcumin, you cannot tell a curcumin, don't do this thing, don't do this thing. It will always do the good things and the multifunctional approach it has. So it will also be securing neurological cells. It will also help to find degradative cells. It will always, stop inflammation and bind direct to enzymes of NF-kappa B, for example.
Mhm.
So this is the multifunctional approach. When you use the substances right, sometimes you don't need this mixture of different things. You need this mixture to make people realize and believe, oh, look, they can do everything. But itself, there are so many substances which have this multifunctional use when they are used right. And I believe through liposomes and through good formulations, you can make them really be this multifunctional agent for the first time.
Totally. Nature has all the answers, and we have to remember we're part of nature. So when we combine natural elements with our own nature, we know what to do with it. Our bodies and nature is smart enough to work and start to heal us and optimize our health.